And this is my continuing coverage of the health care bill. We are now on page number 76. Cost sharing. A community health insurance option shall offer coverage at each of the levels of coverage described in section 1302. This would be the gold, the silver, and the bronze, and the platinum. We already talked about that. Premiums sufficient to cover costs. The Secretary shall establish geographically adjusted premium rates in an amount sufficient to cover expected costs, including claims and administrative costs, using methods in general use by qualified health plans. So, the Secretary of Health and Human Services will not establish premiums for co-ops, but he will establish premiums for this community health insurance option. Like that. Applicable rules. The provisions of Title 27 of the Public Health Services Act relating to premiums shall apply to the community health insurance option under this section, including modified community rating provisions under Section 2701 of such act. So, in other words, the rules governing the premiums on other health insurances will apply also to this. Collection of data. The Secretary shall collect data as necessary to set premium rates under subparagraph A. Okay. National pooling. Notwithstanding any other provision of law, the Secretary may treat all enrollees in community health insurance options as members of a single pool. In other words, he's not going to have pool A and pool B and pool C. There's supposed to be one pool in this community health insurance option. Okay. Contingency margin. In establishing premium rates under subparagraph A, the Secretary shall include an appropriate amount for a contingency margin. In other words, this thing's not going to run out of money. Nice. Reimbursement rates. Negotiated rates. Okay, so now this community health care option has to negotiate with the hospitals, the doctors, the medical services, so on and so forth. Okay. The Secretary shall negotiate rates for the reimbursement of health care providers for benefits covered under a community health insurance option. Okay. So, if you decide to go with this community health insurance option, these people, the Secretary has to negotiate what they're actually going to give back to the doctors and to the hospitals and to the nursing care facilities under this plan. Okay. The rates described in subparagraph A shall not be higher in aggregate than the average reimbursement rates paid by health insurance issuers offering qualified health plans through the exchange. So, in other words, whatever you're going to pay to United Healthcare and whatever you're going to pay to Humana and whatever you're going to pay to Blue Cross and Blue Shield, then this community health care option cannot be higher than any one of them. It could be lower than theirs, but it can't be higher. So, innovation. Subject to the limits contained in subparagraph A, the Secretary, a state advisory council established or designated under subsection D may develop or encourage the use of innovative payment policies that promote quality, efficiency, and savings to consumers. Okay. See how this thing's going to go on here? Solvency and consumer protection. Solvency. The Secretary shall establish a federal solvency standard to be applied with respect to a community health insurance option. A community health insurance option shall also be subject to the solvency standards of each state in which such community health insurance option is offered. Now, wouldn't you like to know what solvency means? Well, you know what? In my next video, I'm going to tell you exactly what that means. Alright, I will tell you more in a future video. Stay tuned.